Today is a question and answer episode, and we are in a new set. Welcome to Azza TV. Thank you for all your questions. I will try to have a question and answer every month. Remember, you can write your questions, comments on the Facebook and Instagram and by email. Now, let's start. The first question, is there a non-surgical way to narrow the nose? Yes, there is a non-surgical way to narrow the nose. Really, if you have widened nose from here, you can inject Botox in the nares, in the nostril here, so it's a little bit narrowed. Also, there is also another way to have non-surgical nose correction, like injecting fillers or threads, but we will talk about it in another episode. How to make the Botox last longer? To make the Botox last longer, it starts from the manufacturer until I make for you. How we store it, the way of dilution, how we prepare the Botox. This is our part. But for you, from starting to the Botox until the 10 days from the Botox action, please don't start to make vigorous exercise that you have too much sweating. Don't go to the sauna. This is a very, very important, and also it depends on how we are accustomed to use our muscles, and of course on the age. I saw creams with hyaluronic acid. Do they have the same effect as injectable fillers? As we said, hyaluronic acid is naturally present in our skin. It gives hydration, support, and our youthful look. But hyaluronic acid, if injected like a filler, it has certain composition. It's like cross-linking how it will last for in the body. But if I apply it as a cream, it's used for rejuvenation. It will not give that much filling like injection like as a filler. Also, hyaluronic acid, I can inject it if I use it for rejuvenation. I inject it with a certain composition that it used just to attract water without volume. Can PRP used for melasma? Melasma is a problem in the pigmentation. It's hyperpigmentation. So, if we use PRP in this case, PRP is used to stimulate the stem cells and giving growth factors that will help to have a new cells. When the new cells are gone, they are away of pigmentation, so it acts indirectly. But I can use the PRP in the course of melasma treatment. First, I can start with the peeling, and in between I injected the PRP, so I am helping the new cells to be good, they mature enough to be regenerated well, and at this time I will have a better results. What is the best treatment of dark circles? Dark circles has many reasons. First, if I have a groove or a defect under my eyes, at this time I need to inject fillers. But there are many other causes, not only the defect or the groove under my eyes. It can be congenital, it can be hyperpigmentation from lack of sleep, decreased skin quality, aging, many other causes. So, depending on the cause, depending on the treatment, if just like lack of sleep, like this, I can change my lifestyle. If I am anemic or I have a problem in hemoglobin, I need to correct it. The other thing for the skin quality, you can inject carboxy, you can inject mesotherapy, many other modalities. This will stimulate the cell, improve the collagen, the oxygen supply to this area, and you have a better skin quality. I did laser sessions for hair removal, but the hair grew again after several months. Why? I thought laser was a permanent method for hair removal. Really, laser is hair reduction, not permanent removal. Laser acts by removing from 80, 85, 90% from our hair. Then it can come back again from 6 months to 1 year, more or less. But when it will come back, it will come back less thicker and less denser, because in the hair follicle root, the stem cells are still present. Is there any good treatment for stretch marks? Stretch marks are two types: red stretch marks and white stretch marks. The red are still more the newer one, and it's easily improved with treatment. But also there is a hope for the white stretch marks. So it depends on the modality I will treat and the results I want and my expectations. I can use carboxy, I can use fractional laser, I can use mesotherapy, which we apply at this time elastin and the things that the skin already devoid of while opening from and stretching. So how many sessions I will take and how many procedures I will do depends on the degree of the stretch marks, it's new or old, and in the same time my expectations and my hope. I hope to be without stretch marks. I just want little improvement, depends on what I want. What is carboxy? Carboxy is a CO2 gas injected in the body. It has many functions. It can be used for the dark circles, can be used for cellulite, can be used for stretch marks, can be used for firming the skin, many other uses. Depending on the cause or the use I wanted to do it for, depending on it, the technique I am choosing. Do you do hand rejuvenation? What's the meaning of rejuvenation here? I'm speaking about there is lack of volume, I need to inject filler first. I'm speaking about skin quality and texture. I have many things. I have PRP, I have rejuvenation needles, I have many sessions. Or I have thickness and I need peel, or I have all of them. So depending on the case, depending on the treatment. Can fillers be injected for breast augmentation? Hyaluronic acid can be injected for breast, for buttocks, for body contouring, for many areas. For the breast, if I need just a little volume and there is no doses, because some cases are already this is for surgery. The choice of the case depends on many factors. There is important thing. You need to know if you are going to do a filler for breast, for your regular mammography, for regular checkup of breast cancer, you need to tell your radiologist that you already have filler before. This is the only thing. Not to mimic between this can be mimicked as like a cancer. So they need to do that you did filler before in their history, so they can check well to differentiate between this and this. But by the way, it's not carcinogenic. What is better, filler or threads? Which of which? It depends. I have a lack of volume, I need filler. I have ptosis in my skin, I need thread. If I have both, I need both. So first, it depends on the case, we can decide. Maybe in some instances I need little threads and little filler. So it depends on the case. This is the time I will choose my regimen of treatment. And at the end, thank you so much for your questions. Please, I'm waiting all the time for your questions. And don't forget to like and subscribe.